Perfect.
And let's get this going and pray we don't have any major technical difficulties.
All right, so I'm going to go ahead and get started. This is meant to be very interactive, and we definitely will have a Q&A at the end. So if you guys do have questions, feel free to throw them up in the chat. I'll go back through as we're chatting to search for those questions, make sure you get those answered. But we really wanted to come today to talk about mindfulness and herbalism on your fertility journey, wherever you may be at in that journey. So today is, really a time for yourself, and we're so grateful that you decided to allow yourself this space to be with us this morning. So Shelley, if you could go on to the next slide. One of the things we're going to be doing today is introducing ourselves. I think it's really important that you know our backgrounds and what our training and education is. So I'll start with myself. So I'm Dr. Sueldo. I am a double board certified OBGYN and fertility specialist. For those who are not in medicine, essentially what happens is after you finish medical school, you have to do a 4-year OBGYN residency training program. And then if you want to do fertility, you actually have to do 3 more years as a subspecialty fellowship. And you have to be boarded in both. So you have written and oral exams in both to have that board certification. After I finished my fellowship, I practiced for 3 years in Florida before moving to Central California. And I've been here a little over 4 years, about 4.5 years now. And so I trained here in Central Valley. I did my fellowship at the University of Connecticut. And I've been fortunate enough to be able to speak both on the national stage as well as at several international meetings. I have many ties to South America. I am bilingual. I lived in Argentina for 8 years. So for that reason, I have a lot of ties to that community and really want to help promote reproductive health in that continent. Here in the Central Valley, I am fortunate enough to be the go-to local women's health expert. And it's not a role that I sought out. It kind of found me, but I'm happy to be talking and spreading that message because I do think it's important. I'm very, very passionate about empowering women through fertility education. Within the both ACOG, the American College of OBGYN, and ASRM, as well as when I was in Florida, we had a Florida Society of Reproductive Medicine. I held positions with all of those organizations. So as I said here, I am definitely passionate about empowering women through education about their fertility. When I began my journey into the subspecialty, it was really about the science and the innovation that was happening in the field. And as I have sort of extended my practice, I've been in practice almost a decade now, it really has, I've fallen in love with it because of the patients. It's really changed me as a person, and the patients are what keep me motivated and moving forward. So Shelley, if you want to go to the next slide. ASRM, which is the American Society of Reproductive Medicine, they are my governing body in terms of guidelines and practice recommendations. And they do recognize integrative medicine as a part of the fertility journey. They talk about it as alternative therapies or complementary medicine. These are terms for practices that are not typically used in conventional Western medicine. And so when you talk about conventional medicine or Western medicine, it's what we've all been sort of brought up in our society to understand as, going to the doctor, the clinics, the hospitals, the prescribed medications, the different treatments. In my world, the fertility treatments of IUI, IVF, and reproductive surgery. So a practitioner of these integrative practices may use herbs, acupuncture, chiropractic medicine, yoga, biofeedback, hypnosis, or homeopathy to treat a patient. Now they talk about outside of standard of care, and I think that this mentality is really shifting. And this is the reason that I wanted to bring both Dr. Rashmi Schramm and Shelley Swapp here today, because really when I talk to patients about their treatment plan, we talk about 3 things. We always talk about the fertility treatment piece, so the medical piece that's going to be happening in the clinic. But then we also talk about supplements and lifestyle, and those are just as important as anything that you're going to be doing in the clinic. And so when we talk about these alternative practices, and I don't really like the word alternative, I really think more integrated practices is a better term, because it really speaks to the legitimacy of incorporating these as part of the fertility journey. We know that Eastern medicine has been around for thousands and thousands of years, and there's got to be something to these practices. And so when you talk about, from a Western standpoint, the studies that have been done here in the US, we talk about the reproductive psychology literature. And it's been well documented that women going through infertility and women going through infertility treatment suffer chronic stress. They suffer higher levels of stress. There's emotional and physical burnout that occurs. And we know that the number one reason that patients stop treatment is that burnout. And those studies come mainly out of the states where fertility coverage is covered. And so finances are not the barrier. Most patients stop treatment because the emotional toll is just too great. So we know that patients who have practices incorporated, whether that is counseling or meditation, nutrition and herbalism guidance, yoga, whatever that looks like, those patients are much more likely to adhere to the fertility treatment and therefore ultimately much more likely to be successful. So for that reason, and then also from an Eastern standpoint, there are a ton of studies out of China, and I think Shelley can really speak to this from her educational background, showing that in fact, patients who incorporated these integrative practices actually ended up with higher live birth rates. So for those two reasons, I really felt like it was important to bring to my audience, to bring to my infertility people, the opportunity to speak with two experts. And so I'm really, really excited to have Shelley and Rashmi here today. I met them earlier this summer and was really blown away by their experience and their expertise. So we're going to start with Shelley. So Shelley, I'm going to go ahead and let you introduce yourself and just talk a little bit about your background and take it away.
Thank you so much. It is such a privilege to be here with both of you today and with all of you. So just for your information of my background, I apologize, I don't have a slide for you for those that it might be more helpful for. But so my background, I came to herbs kicking and screaming, like literally kicking and screaming. I came here not because we had exhausted resources in the search for health care options for my children. But once I got here, I began to see the huge benefits that it offered. And I've never walked away from Western medicine. I know so many people are worried that if they work with an herbalist that they have to leave their Western medicine doctor. And that has never been my case. And it is not the way that I work with my clients either. I have found that adding the supportive therapies from herbal medicine, from traditional medicine, from nutrition, alongside Western medicine protocols is why we have been so successful with the things that we've been trying to achieve for my children's health. And then along the way, realized that so much of what I was learning was what I needed as a woman and what so many of my friends and my colleagues needed as well. And so women's health has become my specialty. I have studied in a 3-year program called the East-West School of Planetary Herbalism. I have studied in China at the Longhua Hospital of Traditional Chinese Medicine, where I did do some specialty work in women's health there. And I've also studied with Dr. Aviva Ram. If any of you are familiar with her, she is a force in this world of bringing medicine and herbalism together for women's health. And so I have studied it with her intimately as well. And I am currently in a program with the Maryland University of Integrative Health to become a certified nutritional therapist so that I can be licensed, which gives me more access, because I'm finding as I'm in this work, having more resources and being able to access more licensed communities and hopefully be able to offer this in more spaces for more people is really my dream. And it's the work that I'm here to do in the world. So if you have any questions about any of those, happy to answer them later. As I was prepping for this today, came across this systematic review, and I was so excited about it that I wanted to kind of insert it for those of you that are interested in the science, what we're seeing. Very recent, so it was just published in 2021. And what they did is a systematic review for those of us who don't recognize, this is kind of the creme de la creme of research, because it's looking at all of the other research that's out there and saying, what have we learned from all these other research studies? And what they were able to see is when they were looking at how do plant compounds, how do they benefit, or do they benefit? Are we seeing a lot of benefit in female health? And the answer was overwhelmingly yes. And the compounds in these plants were helpful for female endocrine pathways, improving menopause symptoms, reproductive disorders, specifically PCOS and ovarian failure, endometriosis, and beyond. And you can read this yourself. I've got the reference for you here in the slide. But that has been my experience. I can speak to that again and again and again with the hundreds and hundreds of women that I've been able to work with, that we do have resources that have been passed down for thousands of years, because women's health has been so crucial in order for civilizations to survive. When you think about Native American civilizations or ancient civilizations, if women's health wasn't a top level concern, the entire society would crumble, because they were the ones who were in charge of caring for the communities while men were out hunting or while they were at war. And they were also the ones who were, caring for that if they weren't able to reproduce, then again, societies would crumble. And so we do have a lot that we can draw from these traditional ways of looking at the body that are very female-centered, which I love. So we're not going to talk about all of these today. I just wanted to give you kind of a snapshot of the top maybe 15 fertility botanicals that you're going to find research around and that you're going to hear about. I've included things from Western herbalism, from traditional Chinese medicine, as you can see, from Taiwan, from Thailand, from all over, from Ayurveda as well. And so these are kind of the top 15. We aren't even going to have time to dive into all of them over the course of the next month, but these are the ones that have a lot of great research and that I'm very familiar with and I use in my practice. I wanted today to just give you something that you could just take and have a quick win with, something that you could feel safe about that's got a really high safety profile. And when we say high safety profile, that means that we're not seeing that it's going to be contraindicated in very many spaces with medications or with other health problems. One of those is spearmint. And it was actually a really phenomenal study that was done. It was randomized, it was double blind. So there were 30 women, I believe, and maybe it was more than 42 women, and they divided them in half. Half of them got a placebo, and half of them took 2 cups of spearmint tea twice a day for 30 days. Super simple, right? And they were followed over the course of those 30 days, and they had their serum androgen levels checked. And at the end of those 30 days, they saw a significant reduction of total testosterone in just 30 days. That's pretty phenomenal. And that was above the group that had the placebo tea. So it wasn't just the tea, it wasn't just having that wonderful experience of sitting down and being mindful of a cup of tea twice a day. It actually was the spearmint. And because I get asked this all the time, and the question and the answer is almost always going to be no when it comes to essential oils. Like if we see that an herb is beneficial, I always have someone say, oh, can I use the essential oil? And the answer is 9 times out of 10 is no. They're not going to give you the same benefits. But in this particular situation, they did another study where it was a controlled study again, where they used essential oil. And this was on rats, so this wasn't on women. And we need to take that into consideration. But they did find very similar findings in the controlled study when they used spearmint essential oil. So we do have some great resources there to draw on. And it's one that I love to suggest to people, to women or to those who are struggling with high testosterone. It's a really simple thing to add into your daily routine. Just 2 cups of tea twice a day, or a cup of tea twice a day. How's that? And for those of you who maybe that testosterone isn't the issue, and we're not going to have time to go deep into this right now, but I just wanted to kind of help you see that there are more resources out there for wherever you're at in your journey. 2 of my favorites are Chyawanprash and Ashwagandha. And these are both from the Ayurvedic tradition. If I could have everybody take one thing, it would either be Chyawanprash or Ashwagandha. I call these my gateway herbs of all things, because they do have such great results that they can present, that they can give immediately. Chyawanprash is something that's given to children and is taken throughout the life cycle in Ayurvedic cultures. And we do have research that shows that it helps to support the respiratory system, but also helps to support the hormones. It helps to balance out hormones. It helps to support the menstrual cycle in women. And it's also supportive for men who may be part of this fertility challenge with you as well. And then ashwagandha is another one. It's one that I love when someone comes to me and they're like, is there something that you could give me that will just help me because I'm so stressed? and I'm not sleeping well, and then I know that I'm not sleeping well, and then the stress is causing this. And ashwagandha has more of a positive feedback loop that helps to reset that cortisol level. It's one that I would be cautious with if you're not eating well. You need to be eating well. She gets really frustrated and doesn't work well if you're not being willing to eat and feed your body. But for most people, it's a really, really wonderful, beneficial herb. And we'll have time to go into more of these as we jump into the next couple of weeks. And we'll tell you more about that in just a minute. But I wanted to give you just a little bit of a snapshot of what you can expect when we're looking at herbs from both a complementary medicine and evidence-based perspective and a traditional perspective. And then just keep in mind that we don't always have evidence. We don't always have hard, solid research around why these herbs work, because we still don't quite understand all of the different pieces of the puzzle, right? We don't understand all the pieces of the puzzle of the human body. We certainly don't understand women's health as well as we would like to, and we need to at some point. But this is just a statement from the Chakra Samhita that what is perceptible to the human, to humans, is merely a petite fraction of the cosmos, and what we cannot observe is far more than that. Which doesn't make it non-existent. It's just a really beautiful way to go. There's so many other ways that we can support the human body through plants and meditation. And so I'm really honored to be here, and I'm happy to answer questions at the end, but I want to make sure we give time to Rashmi to present her expertise.
Shelley, that was amazing. Thank you so much. And as a fertility specialist, I think the big sort of glaring like neon for me is the high safety profile. The fact that these are, well tolerated, minimal risk, low interaction. Those are all things that to me are resonating. And I'm like, yes, 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 yes. So that is great. And thank you so much for sharing that. I do have a couple questions at the end, so we'll definitely make sure to ask those. But I want to make sure we have time for Dr. Rashmi Schramm. I am really excited for you to introduce yourself and share your expertise with us this morning.
Yeah, thank you so much. I'm so thrilled to be here with you guys. So my name is Dr. Rashmi Schramm. I am a board certified physician. This is actually my 23rd year of practicing medicine. And just the other day for fun, somebody asked me how many patient visits I thought I had. And so I just kind of did a quick, rough estimate, and it's somewhere around 98,000 visits. That's a lot. And so I've had quite a lot of experience. And the way that I came into meditation was also somewhat in a way of teaching meditation, was a little bit of an accidental thing, kind of like Shelley was talking about as well. And what I mean by that is I actually grew up in India. So I was really well immersed in yoga, which is really meditation. So it felt really comfortable and felt like home. We immigrated to the US to a very small coal mining town in Virginia when I was 12. And, really from that point on, there was kind of this need as we sometimes have during adolescence to just fit in. And so I kind of dropped everything that I kind of knew and understood. And I found myself, about 10 years ago, really just having just this chronic low level burnout, this sense of dissatisfaction with life, even though when somebody maybe could have looked at me from the outside in, I looked perfect, everything looked perfect. But I was just suffering from this low level of just kind of feeling irritable a lot. And so I had over the years been dabbling in meditation here and there, and I knew that I was getting benefits from it right away. And so I, for then the next, 2-3 years, would practice meditation, fall out of it, practice, fall out, that kind of thing. And I would call myself a crisis meditator. And moreover, I would actually call myself like a closet meditator, because I wasn't, in the way that I was practicing medicine, and where I was in that point, sort of psychologically, this is 12 years ago, it was almost seemed like a weakness. And so of course we know that's absolutely untrue and all of that. And so at some point in the last, 8-9 years, I recognized that this is so worthwhile for me to pursue. This was so time efficient and cost efficient for me as a way of having this tool that I signed up to be a teacher, because one of the kind of like, the person that was talking to me when I wanted to sign up for this course, he literally said, look, if you're serious about it, that we only want people who are serious about this stuff. And one of the things that we really need for you to understand is that you have to meditate every day. And this was like a 1.5 year long thing that I was agreeing to. And I was like, yes, sign me up, because I recognized that I needed that external accountability. And so I signed up for this, for the accountability, and I got this beautiful, gorgeous deep dive. And, once you kind of dive into this, it really opens up everything else. And so my medical education, my undergrad and med school were at the University of Virginia in Charlottesville. And I've really been on the Eastern Seaboard for quite some time, but really my Ayurveda education, which I also got through the Chopra Center, that's all been in Carlsbad, California. So I was going back and forth, in my meditation teacher training as well. So really the Chopra Center has been kind of my gateway into a lot of this stuff. But then it also opened up to a lot of different integrative modalities that are related to meditation as well, that I was then working in. And I agree with Dr. Sueldo, and especially, in that we don't call this alternative, we call this complementary and integrative. And Shelley talks a lot about this as well. And so I started to integrate this into how I was helping my patients. It was blowing their minds. It was blowing my mind. And so I started to get really kind of serious about offering programs. And so I actually, in addition to that, I'm also trained as a coach. I am certified. My coach training, my integrative coach training is at Duke Integrative Health. And so I was there for a while. And in the way that a lot of times we like to have more and more certifications. And so I am a national board certified integrative health coach. And really what that means is that I've had more experience in this cognitive behavior psychology world, if you will. So it's a melding of the East and the West is kind of how I see this. And I also see how meditation can be incredibly useful with coaching. So I am the founder of Optimal Wellness. And so this is a company where we use coaching and teaching, and I help busy women to ditch guilt, and I help them to tap into their own inner peace and power, which is exactly what I'm going to be helping you do. And I help these women also live these more energetic and fulfilling lives. And we do that by combining meditation with coaching. And so I'm so thrilled to be here with you guys today. And so I like to just start off with what meditation is, what mindfulness is, and because, there's so much mysticism. And so with herbalism, there is too, right? So that's really why Shelley and we like to demystify, first of all, and we also like to simplify, because this can be potentially very, very complicated if we want to make it complicated, and we don't make things complicated, they're simple. And so meditation, in the simplest, most basic way that we can look at it, is just the journey from activity into stillness. That's literally all it is. We're not creating the stillness. We're not creating the silence. It's already always there. And so it's just that journey to tap into what's already always there. It's a formal practice of mindfulness. It is the fastest way for you to build up your mindfulness muscle, if you will. And mindfulness is also one of these things that's become a hashtag, and I like to define it. So mindfulness is really the awareness that arises as we are paying attention to this present moment without judgment and with curiosity. Right? So really simple, but somewhat challenging for us to do, because we might find ourselves really ruminating about the past or worrying about the future, and we might forget to live in our present moment. And so mindfulness is a really great way to bring ourselves into this present moment. And it's a beautiful way to de-stress the body, to de-stress the mind, to metabolize this chronic daily stress that we have. And it's also a wonderful pathway for what we call homeostasis, right? Homeostasis is this dynamic non-change in the midst of constant change. That's really what's happening in our bodies all the time. There's dynamic non-change in the midst of constant change. And so it's a great way to bring ourselves into that balance. And that's why I love talking about meditation, and I love teaching meditation, and we're actually going to be meditating together. So Shelley, would you get us to the next slide, please?
I'm going to try.
Thank you. And it's okay if not.
All right. I don't know why it's not moving. Well, keep going, Rashmi, I'll fix it.
You got it. So the next slide really is just, it gives us an overview of what happens to us when we are dealing with chronic daily stress, right? And so we know beyond the shadow of a doubt, if you're here right now, you have more than the level of stress that is helpful for us. There is such a thing called eustress, which is incredibly helpful. But really what we know is there has been an epidemic of chronic daily stress that was there before the pandemic. And what's happening is these layers of these stresses have added and added and added. And as that's been the case, we tend to see a whole host of health issues, right? And so think about what happens in a quick response system, right? So, and we as human beings have evolved over hundreds of thousands of years, but our parasympathetic and sympathetic nervous system has roughly remained the same for hundreds of thousands of years. And what that really means is when we are sitting in traffic, if we're late for a meeting, if we are in a stressful situation in a doctor's office, if we are, late for work, if we're having difficulty in a relationship, if we get an email that we don't like, all of those things can produce the same exact results in our bodies and our minds as if our ancestors were dealing with a saber-toothed tiger. And that is that fight, flight, or flee response, right? And so, and it's not a bad thing. It was really just meant to help us survive. And so think about what happens if let's say one of our ancestors came into contact with a saber-toothed tiger. Well, the sympathetic fight or flight response is going to take over, which is great. So that means that there's blood that changes where it's going to go. So there's different priorities given to different areas of our bodies. So that means the pupils dilate. And there's blood that's shunted from the bowels. So, it's not a time to worry about digestion. There's blood that's shunted from the reproductive organs. This is not a time to worry about reproduction. We're trying to survive, right? And there is, a whole host of things that prepare us to make quick decisions. So the heart rate increases, we take these short, shallow breaths, and we're ready for the fight or flight. But guess what? It was an email. There was not a saber-toothed tiger. And guess what? We don't know the news that we're going to get in the doctor's office, but yet we're dealing with it in this particular way. And what can happen over time, and we have seen that we are all dealing with this level of chronic daily stress. And what can happen is we can then become chronically in this inflammatory, stressed out state. Rather than being in homeostasis, we can be in this exhausted, stressed out state. And we know particularly, and Dr. Sueldo just talked about this too, we know that going through a fertility journey, there is a high rate of burnout. There's a high rate of increased stress levels. There's a high rate of increased emotional stress level. In addition to physical stress, there's a lot of physical stress, emotional stress, and mental stress that people are going through. And so that's really why meditation can have such an amazing effect. So Shelley, if we can get to the next slide, and it's okay if you can't, because, I can talk all day. So you gotta figure out. And so and I mentioned this as well, that I turned to meditation when I was dealing with stress, several years ago, right? And it still remains, right? So I talked about where I learned. I have a multitude of different types of meditation that I'm certified to teach, and I teach. And I also am certified in yoga therapy, which is a beautiful way to meld yoga and psychology and emotional well-being and meditation together. And what we know is this, we know this beyond the shadow of a doubt, is that meditation is a beautiful, powerful antidote to the chronic daily stress that we're facing. And why is that, right? So whether you're a first-time meditator, a seasoned yogi, really doesn't matter. Within just the first 5 to 6 minutes of any meditation, what we see is that we move from that, remember, that chronic daily sympathetic response where we're trying to survive, into that parasympathetic rest and restore response. And what happens there is all the exact opposites of what happens in the sympathetic response. And really what that means is we start to change the blood flow. So the blood flow changes in the brain. We start to have less reactivity. The blood flow changes in the reproductive tract. There are dozens of studies that are just beautiful, that show us that there are these changes that can take place immediately. And then even long term, we start to see more and more and more changes. So you don't have to, go off to a meditation retreat. You can come and meditate for a month together with a group. You can do just this one meditation, and you start to see these results very, very quickly. Over just 7-10 days, we start to see decreases in cortisol. That's really kind of, guilty of, if you will, even though it serves really well when we need it, instant inflammatory response, that it can keep us from going into our own natural homeostasis that I talked about, into our natural balance. And so meditation can bring us back to that. Well, now there are, thousands of studies that have been published that show decreased anxiety, overwhelm, decreased, and increased resilience as well. And there are, at this point, at least, I can pull up over 50 studies that have been done in the fertility space and looking at mindfulness and meditation. And what we see is beautiful and astounding. What we see really is there's a net positive effect when somebody incorporates a routine meditation practice. One of the easiest ways to look at, and one of the studies that came out really just last year, shows a significant increase in hormone level DHEA, right? And we've seen that in lots of other studies, but in this case, they looked at women going through fertility, and this looked at men and women. And what was really beautiful is their DHEA levels within 3-4 weeks increased by 30 to 40%. And what DHEA can do, amongst a whole host of other things, these are feel-good hormones, these are the anti-inflammatory hormones, is it can actually increase the longevity of our cells, including the eggs, including the sperm. And so what they saw when they had this beautiful study that they did was they had increased assisted reproductive transfer success when they had couples meditating. They had increased success of live birth and overall reports of decreased levels of chronic stress and chronic anxiety and chronic overwhelm that people were feeling. So it was really a beautiful study, and it really just came out in the UK last year. And so those are, and we are just starting to do these studies, right? And we joked about, Dr. Sueldo and Shelley and I we just joked about this a little while ago. These practices have evolved over thousands of years. And scientifically, I consider myself to be a scientist. We're like 22, 23 years into studying this stuff. And so there's a whole host of other things that we're going to be finding out, and which I'm really excited about as we continue to study how we can improve our lives with meditation. Shelley, I think we can go to the next slide. Which is just, there to make you laugh. And so, yes, we talk about meditation, but let's try it, because if we're not meditating, we might still be feeling stressed. So are you guys ready to meditate? Show me like a little show of hands here. What do we got? You guys ready? Okay. I think we're ready. So yeah, so let's meditate together. Yeah. Beautiful. Beautiful. So we've got some yeses in the chat, and yeah, absolutely. Yeah. So let's, you guys, if you're comfortable, just go ahead and you can gently close your eyes. If you'd like, you could maybe just do a little bit of stretching here. Just get any kinks out. Just kind of take a moment, maybe take a stretch or two here. Just come into this beautiful moment that we're all sharing together. Okay, Kristen's ready to meditate. All right. So when you're ready, let's just, go ahead and very gently close your eyes. And just notice if there's any expectations. Just noticing if you can gently just let some of those expectations go, just coming into this moment. Let's start by taking a few deeper breaths. And as we exhale, see if you can make a big audible sound. And just letting go of anything that's not serving you right now. We can always pick it back up in a few minutes. Just taking a couple more deeper breaths. And just gently noticing, can your shoulders drop away from your ears just a bit? And the jaw be more relaxed. Is it possible to release the tiny muscles around the eyes? Just gently putting your attention on your body. How does the body feel today in this moment? Just noticing if there's an area of tension, just gently breathing into it, giving it space. Not trying to make it go away, just breathing into it. Just gently putting your attention on your mind, noticing the thoughts that arise and subside. Not trying to control it, just noticing the thoughts. Just gently noticing the abundance in your life that's already here. Abundance is a natural quality of life. It doesn't have to do with what we physically have. The energy of abundance is all around. Every cell in your body has everything it needs. Abundance isn't a goal, it's our starting point. You are already enough. Beginning to trust the abundance already there. Noticing that our lives flow with abundance and grace. Abundance is a state of mind. Let's be generous in our thoughts, our words, our actions. Just gently putting your attention on your breath. Just noticing the breath. Inhale, exhalation. Just allowing the body to be breathed right here, right now. If you find that your mind has wandered from your breath, you've done nothing wrong. Gently returning back to the breath. Still keeping your eyes closed. Begin by taking a few more deeper breaths. Returning back to the body. Scanning the body gently. Noticing if there's a softness to the breath. Allowing it to be just as it is. Just bringing in a deep sense of gratitude at the level of your heart. For the many gifts in our lives. Gratitude for yourself for creating this space in your busy life. Gratitude for this time together. And if you feel so inclined, you can bring your hands together in prayer position at your heart. Just bowing to yourself. Just as you're ready, you can gently open your eyes. And this is just a gesture. We also say namaste, and it really just means, roughly translated, the divine light in me sees and honors the divine light in you. So it kind of recognizes that we are beautiful lights. How are you guys doing? Yeah, securely, you're feeling centered. Me too. Yeah. So you're feeling calm. Yeah. It's such a great way to start our weekend, isn't it? Yeah. Bridget, you're feeling grounded. Yeah. That was just 8 minutes of our lives. So grateful for this, to be able to share this practice with you all. This is a great time, I think, to hop into a gift that we'd like to give you guys. Shelley, if you we have it. So first of all, we're so grateful for you guys to have joined us and to have practiced that meditation and to be able to dive into, herbal, just the spearmint tea. If all you did was do that, you've got, lots of resources. We'll put this particular masterclass online. So you've got that, and you can always practice the meditation again. So really grateful for you guys to have joined us. And for many of you, this is all you need. But there are also many more of you who are looking for a deeper dive. This was a great way to dip our toes in herbalism and meditation. And so we created together, really the three of us, we've created this beautiful immersion program for those of you who are just ready to take this to a deeper level and work with us in a very intimate setting, if you will. So really what we've designed is a month-long immersion program. We start October 1. And we are going to have live sessions for you with each of us. We are going to create a beautiful little community within this space so that you can have peer support and have that community where you belong. And we're going to really be able to help you tap into that inner peace and take those beautiful tools away that you get to learn in a month, and you can use that really for a lifetime for fertility and beyond. And so we're going to really tap into evidence-based herbal remedies. We're going to tap into evidence-based meditations, into breath work. So I bring in some Ayurveda as well. And so this is just a beautiful offering, and we felt that it was just urgent when I started to look at the studies of how many women and how many couples were going through this journey. And we have these tools that are right now untapped, and so that's why we want to bring that. We really want to bring that to you, no matter where you are on your fertility journey, like I said. So I think, Shelley, I think you've got even more to tell us about the program.
Oh, we were calling it an immersion program because we really want to have the opportunity to really just dive in and pour into you in your journey and help you just experience some of these tools that Dr. Rashmi and Dr. Sueldo and I have come to love. And we want to be really transparent about the fact that all of this is evidence-based. And especially for those who may have had some experiences with other people who have just discovered herbal medicine and maybe they're really excited about it and perhaps don't quite understand all of the different nuances that go into understanding women's health, and have maybe talked to you or tried to coerce you into doing something that maybe wasn't so helpful, or maybe you've got some crazy experiences in your background. We wanted to be really aware of that and make sure that what we presented was evidence-based. These are things that I practice regularly with my clients. It's a work that I have never advertised before, but I have, for the last 10 years, have had women who have come to me continually who are searching for help and for support in their journey. And it is some of the most tender work that I get to walk hand in hand with women with, and I love it. I have several women right now who we are in preconception work stage, or we're in, the first 8 to 15 weeks of a pregnancy that they didn't know that they could sustain. And we've been able to work hand in hand with their specialists and adding herbs and things to help support both their hormonal balance and with their stress reduction and their sleep and all those things as well. So we're really, really passionate. I'm so excited to get the opportunity to work with an amazing fertility specialist and an amazing physician who is also a meditation expert and specialist. And I can't imagine a better combination of resources to be able to offer women who are in this very tender space right now.
Yeah. Thank you so much for that, Shelley. It really, for me, was about bringing options and bringing resources to my patients so that they can really feel empowered in their fertility journey. And if you want to move into the next slide, we can chat a little bit about that. And, during the course of the 4 weeks, what we're going to be doing is live sections with each of the experts. The fourth section, you actually get all 3 of us together. There's going to be recipes, meditations included, and the private community where you'll be able to interact with us regularly. As I mentioned in the beginning, this to me was really, really important to bring to my audience, because daily, the question I get asked from my patients is, what can I do? How can I help myself in my journey, wherever they're at? And it was really important to me to find, science-backed, evidence-based, experienced, knowledgeable experts who can really bring that wealth of knowledge that we just don't have in Western medicine. So the 3 of us genuinely believe in marrying the East and West, and genuinely believe in complementing each other. So there's the fertility clinic piece, but then there's so much more, right? And so really for a month, we're going to really work together and have that accountability, have that group, have that support, because we know that those patients are the ones that have the better outcomes. In terms of the pricing, for me and for my audience, this is something that's new, and it was really, really important that we price it at a point that would encourage patients to want to explore this and to want to dig deeper and want to get to know these adjuncts or these resources at a deeper level. And so that's why, even though the value is huge, I mean, I went through Shelley and Rashmi's course that they did over the summer, and my mind was blown. But we really, really wanted to price it this way for the audience, because we knew that this was going to be a new space for many of you. This pricing is not forever. We did price this specifically for you guys who are taking time out of your Saturday to be here. This pricing will be open for 48 hours only. We actually opened our doors this morning, and we already have somebody registered. You will have immediate access to the content even before that October 1st start. And we really feel that this is an offering that we want for patients who are ready to navigate something deeper and further. From a transformational standpoint, those who know me will tell you that I have been for many years very resistant to Eastern medicine. And I don't think it's resistant more so than skeptical. It was always sort of out there. I had patients who would ask me about it, and I was like, well, if you want to do it, fine. But, I didn't really, the science is out, isn't, there yet and whatnot. And I think it really was a limiting belief or a limited view of what we can really offer our patients from a stress management standpoint, from a lifestyle optimization standpoint, from a support standpoint, and from an empowerment standpoint. I think for me, again, going back to, I've been in this for almost a decade, and there really is this sense of loss of control and sort of how can I get some of that control back while I'm in this journey? And I really have discovered that these techniques and these integrative practices allow patients to navigate that journey with so much more ease. And so really working with Rashmi and Shelley over the course of that month, it really opened my eyes and honestly my heart, as cheesy as it may sound, to really wanting to offer this to my patients as adjuncts, as integrated practices to what I'm doing every day in my office. So I don't know, ladies, if you want to add something else, but what changed my mind about Eastern medicine? These 2 women, to be honest with you. I really felt like they were coming at it from an evidence-based, science-backed standpoint. They both had extensive knowledge and extensive experience in what they were doing. It wasn't just some kind of fad thing that they hopped on. Both of them have been doing this now for well over a decade. And so it really, working with them really, really opened my eyes to what the outcomes can be. And as I started to explore it more and look at the studies and the research behind it, I really had to recognize that what my previous posture was really limited, to be honest with you. Ladies, I don't know if you want to add anything to that. Sorry, I kind of went off a little bit there.
Yeah, no, we had some really good questions here. Lee was asking just, hey, what the schedule is. So we've got live sessions every Monday at noon for you guys on the West Coast. It's, 3 p.m. for those of us on the East Coast, but it's no worries because we're always going to be recording it, and it's going to be in the portal within, an hour or so of finishing our sessions. And if there's something that pops up in there and you have a question, you can just ask us inside our private Facebook group. And often that's actually the case. And so we, this is not the first program that Shelley and I have done together. We have good experience with what works, what doesn't work. We've gotten lots and lots of feedback and data. And I know Shelley runs her own programs and I run my own programs. And so this isn't our first rodeo, if you will, but this is our first rodeo at this limited time pricing for sure, because we know that this is so urgent. This is so necessary. And this is something,
I'm so sorry to interrupt you, Rashmi. But yeah, for me, this was something I basically cornered these two women and was like, please, you have to work with me. You have to provide, some sort of offering for my patients. And so this pricing, they were just, they were gracious enough to do this for me, for you guys, for our audience. But this won't be forever. So I'm so grateful to these two women for, giving us their time today, but also giving us this offering over the next 4 weeks, because I think, for myself, having gone through the course with them, just my eyes were so opened, and it's hard to explain unless you actually go through it. But for those of us coming from a medical background, I think we are very resistant. And I use that word because, I think that's how we're trained. I think that's how we're educated. And I think that when you see the data, when you say the safety profiles that Shelley was talking about, and it was out of the scope of today's practice, but she mentioned Triphala, which I've incorporated into my daily habits, and it's actually been wonderful and life-changing. So these two women, they're definitely experienced. They definitely know what they're talking about. I do want to leave some time for questions. I actually do have myself a couple questions for both of you, if that's okay. And then for those of you watching, if you do have questions, please throw them up in the chat. I do want to be sure to get to all of them today before we close out the talk, because I know we're right at an hour now. But my first question is for you, Shelley. We talked about spearmint tea today. But I do know from hearing you before that, where you get the herbs or what herbs you're using definitely matters. And so if someone after today's, seminar wants to incorporate spearmint tea, do you have a recommendation or somewhere where they can go for this, not just getting it at their local grocery store or something? What would you recommend?
Great question. And thank you for asking that. So there are a couple of brands. If you are the type that you would love to just go pick up something or order something online and you'd like to use a tea bag, traditional medicinals is always going to be a really great choice. They have a phenomenal safety certification process. They're very sustainable, and they're very aware that they're marketing their products to people who are going to be using them alongside Western medicine. So that's a brand I love. For spearmint tea, especially, puka herbs is another one that's phenomenal. I will put some resources for you in the email as we send it out, because I did talk about that, and that's really important to me, is that we choose herbs that have been propagated wisely, because there is risks that are associated, right, when we use things that have not been grown in safe manners or processed or packaged in safe manners. And then if you are fortunate enough to live in a space where you have access to a great herb shop, use them. Check out their background and everything, of course. But as herbalists, and there is a phenomenal community of us across the country and across the world, and we're really dedicated to supporting growers who are doing things in a really sustainable way. And so, if you have access to get some loose leaf tea that's organic, that's been procured by someone who really loves these herbs, utilize them. Really, honestly, use them. I love having loose leaf herbs for my clients because they're such a different experience.
Beautiful. Thank you so much. Yeah. And if you could include those in the email, I think that would be awesome for the audience listening live and also in the replay. And then Dr. Rashmi Schramm, I actually do have another question for you. So I am like dipping my toe. I'm like a little baby when it comes to meditation and mindfulness. And I definitely don't do it enough, because when I do it, I see the results immediately. And I want to ask you, is there like a minimum number of days per week? And this is the doctor and me like thinking about a prescription, right? So is there a minimum number of days per week that we should meditate? Is there a better time of day, morning or evening, that we should meditate? What do you typically tell people?
Yeah, we actually, you know, when I'm working with somebody and even inside programs, we start off really, really small, because if I say I want you to meditate for 30 minutes a day, I know it will not happen. And so it's really, you know, sometimes we'll start with 4 minutes a day, with 5 minutes a day. And as that starts to feel like it's too little, and that will just happen very naturally, then you can kind of increase it over time. And as with really anything else, whether we're talking about nutrition or exercise or, you know, anything else, consistency is always the key. And so consistency, you know, I literally have like, I have that hammered in all of my like, you know, vision boards, consistency over intensity, because I am somebody that can become very intense very quickly, or I think intensity is the better way to go. I'll just meditate for 2 hours or something like that. And I know I'm not the only one to think that way, because I used to think that way about exercise too. But it's really the consistency that gives us those results, particularly within the way that we can balance the body and the mind, and we start to see those benefits. You can start with 4 or 5 minutes a day, and that will automatically give you results. And then as we start to see those results outside of the meditation, because I always talk about, look, this isn't actually about your meditation practice. Yes, you know, let's practice this, but start to see what's showing up for you outside of your meditation. And that's what's really beautiful about this. So consistency. And generally, you know, you asked what time of day. I generally recommend the morning, because when we have something scheduled for the morning, it usually does get done.
Got it.
And so, you know, if you wanted to get up, brush your teeth, take a shower, sit down, meditate for 5 minutes and go on about your day, that's great. I mean, depends on, you know, I've got folks who will do all of their morning routine. They'll get to work 5 minutes earlier, sit in their car and meditate for 5 minutes, or they'll get to like a pickup or a drop off or something like that, and they'll sit and meditate for 5 minutes. And so it doesn't have to look any certain way. You just need 2 things. You just need to sit down and close your eyes. That's it.
Right. Perfect. I love that. And then Shelley, it looks like there's a couple questions coming in for you. So one is from Tanya. She says, the spearmint tea seems to be beneficial in PCOS. Are there other benefits, for example, unexplained infertility?
In unexplained fertility?
So unexplained infertility, sorry, for those who don't know, is going to be where there's no disease that's been diagnosed. So the couple is having trouble. They've been trying for over a year. They've done an evaluation. Everything is coming back normal, and they're being recommended for fertility treatment.
So if we were looking at the evidence, no, we don't. We really don't have any studies around that with the spearmint tea. Is it going to be? Is there potential that it could be problematic? Probably not. We actually did. They actually did track the women in a lot of these studies to see if it brought hormone levels too low or caused any problems. And the answer was again and again came back, no. I mean, there really weren't side effects to this. So is it something that's worth trying? In my opinion, in my professional opinion, yeah, it is. It's definitely a place to start. But in unexplained fertility, we would want to be adding probably some other nutrients and some things as well, which we've talked about inside of
during our program. Perfect. Connie says 2 things I'm wondering. Number 1, are there Eastern Western practices that prevent fibroids? And then number 2, things to do after you're pregnant, or is this mainly for before you're pregnant? So, I mean, those are 2 like huge questions. So definitely, you know, it's going to go beyond the scope of today's talk, but maybe just a snippet answer of each one.
Yes.
The answer is yes. And we, you know, that's why we're calling this fertility and beyond. Everything that we are going to be doing and teaching, there is going to be a continuation into pregnancy and beyond. And so when we talk about high safety profile, we're talking about an assumption that you are pregnant right now or going to be pregnant in the next couple of weeks or the next couple of months. That is why we're talking constantly about safety profiles. And when I picked out the kinds of meditations that I want to teach and the kinds of breath work that I want to teach, teach, it's really based on an assumption that you are imminently pregnant or are pregnant and are going to be going through the pregnancy. And it will help with fertility and beyond. That's really why we're calling it that. I hope that helps.
Yeah. And this is, I'm sorry, go ahead, Shelley.
Yeah. Well, and in my case, so 90% of the things that I'm going to recommend are things that we know we don't have any concerns if you were to become pregnant while you're using these. And honestly, there's several things that I do recommend depending on the situation that I will provide data to doctors regularly and say, please do not take them off of this, because we have data that shows that it increases the chances of them being able to carry this baby to term if they'll use these through their first trimester. And so yes, I absolutely want to be holding hands with women who are in those early stages and are concerned about pregnancy loss or those types of things. If there are some things that we would recommend that we'll talk about that are great for fertility, but maybe aren't great, or that we don't have any sort of data around the first 8 weeks of pregnancy, my recommendation is always, we're going to take this up until ovulation. And then, after that, I'm going to have you stop it. We're going to take a break for 2 weeks. And then if we find out that you're not pregnant, then we'll start it again. And I do that all the time with my clients, just to say, let's just support this through these stages. And then we're just not even going to take the chance of having any question in our mind.
Yeah.
So.
And I think, again, just sort of circling back to the fertility specialist in me, like this was why it was so important that I bring you and Dr. Rashmi Schramm here today, because I want to make sure that if my patients, or if the audience, I should say, is going to be exploring this, that they're doing it that they're doing it with people who understand the science and understand and have the experience to tailor this to the fertility and beyond space, because the same is true in Western medicine, right? So, think about patients who have thyroid or diabetes. We're going to optimize or tailor those medications before we even start the fertility treatment, because we don't want to be trying to stabilize and figure that out once they're already pregnant. So this is all kind of going, again, sort of that integrating of Eastern and Western. It's all happening preconception as well, and then just carried through. Kristen asks, our fertility center offers acupuncture on transfer day. Any evidence for this? They also have a link for yoga exercises around transfers as well. The short answer for me is yes, there is evidence. I do support it. It's not for everyone, but if you are somebody who pursues acupuncture, who believes in it, who has found success with it, then I absolutely encourage it. There's certainly no downside that I'm familiar with. I don't know if Rashmi or Shelley, you have anything to add to that.
I actually typed in the chat for Kristen too. That's a great question. And yes, there is evidence. And so this is why we're like having this beautiful interactive time. And so we're going to have lots more time to delve into so much of these other evidence-based practices that are just not very mainstream, because again, we recognize Shelley is a unicorn. We recognize I am a unicorn. I mean, really, there's just, because you do have to be able to learn the science, understand the science, but also sometimes go beyond the science, because, a lot of my studies are from physicians who are teaching meditation and mindfulness and yoga. But we're going beyond the science, because there is stuff beyond the science. And so we always stick to safety first. And after that, we go into how else can we increase our resilience and enjoyment of life? And how else can we be more present? How else can we, all of the things that improve your quality of life is incredibly important.
Yeah.
And my perspective is always, I want to be able to have women who can look back and say, I did everything I possibly could.
Yes.
I took the best care of myself. I took the best care of my pregnancy. I took the best care of my fertility, so that whatever happens, because we don't have any guarantees, none of us do. We at least don't have the regret of going, I should have taken a little bit better care.
Yes. 100%. I could not agree with that statement more. That's beautiful. Lee asks, thought on Arvigo abdominal massage. I'm actually not familiar with that technique, so I cannot give an opinion on that. I don't know, Shelley or Rashmi, if you guys have any experience or knowledge with that.
I have some colleagues that are trained in it. I have not ever had any experience with it, but I do have some colleagues that are really trained in it, and they have good results, but it's not something that I would be comfortable speaking about as far as outcomes.
The literature, the science. Yeah. Okay. And then I did have one more question come through. They want to know a little bit more about the program, a little bit more detail about the process. And so I'm going to hand it over to either Rashmi or Shelley to talk about the process. And I do think it is important to talk about that, but I also want to focus on not so much the process, but what you get out of it. Because for me, the course that I did with them was really transformational in terms of my outlook, my perspective, and now how I counsel patients and what I offer to patients. And I think that is incredibly beautiful. And so that, as a fertility specialist guiding my patients, and, they're entrusting me with their care, now being able to see this and sort of being able to offer this is just, I think it's amazing and real, like I said, really transformational. So anyway, we'll talk about the process, but I did want to just emphasize that point.
I love that. And I can speak to that as well. That is a word that I think is used often in folks as they give us testimonials. Their perspective shifted. They started doing just one simple thing because that's what we focus on, right? We focus on, there is an enormous amount of just potential things that we could all be doing. In fact, we could do this as a 10-year program and still not run out of stuff. And, but that's not what we're doing, right? So we're really careful and we're really mindful and conscious that your time is your most precious resource. And so we are going to really simplify some very, very complicated concepts, and we're going to make them highly actionable. And so what that results in is you taking something away immediately that you can do right now that will change how your next month looks, that will change how your next week looks, that will change your relationship to other people. And that's really what we're after is yes, we all learn, right? And learning is really, really important, but being in community and having a live program, whether you can make the live sessions or whether you're coming into our group to ask us questions, is so much more valuable and gives us so much more of that transformation. And by the way, when we say transformation, it's a big change in a short period of time. And that's what we're after, right? And so, and that's why we're here. That's why we've seen it happen over and over again. And that's why we took the time to offer this for you, so you can find out a little bit more about us, so you can see whether we're the kind of people that you want to work with or not. And we hope that we are, and really get to know each other and be in this community together. And so I would say, really testimonials wise, the month long is just beautiful. If you sign up right now, because you can right now, not only will you get the lowest price that will ever be offered in the history of this program, period, for the next 48 hours, it will never be this price again. That's just the truth. But you'll also get immediate access right away. We've got beautiful recipes that Shelley's got in there. And there are really kind of these really evidence-based micro meditations, longer meditations that you can start right now. You can just start this weekend, and then we'll start October 3rd is our first live session, but you'll get access to all of this for the entire month of October. But if you start now, you'll get the lowest price and you'll get the longest period of time. So it's kind of a no-brainer. So we try to make this really easy. You don't have to make too many choices here. It's just, whoop, there you go. So I hope that helps.
And so what the way that it's set up is we meet weekly for 1 hour. That's our live time. And the thing that Rashmi and I have found that is so powerful about that is it builds community, and it also builds accountability. It's not just, something that you have to get in and turn on your own. We are going to be there holding space for you that first, I believe the first week we're going right into herbs. And that'll be recorded so that you can review it. I'll have the slides available for you so you can check the literature. And then the next week you'll have Dr. Schramm, we'll go into meditation, and you'll have things that you can just take right then, utilize. You'll be able to talk with us on the Facebook page, so that we can hold your hand and really kind of just pour into you over the next several weeks. And then Dr. Sueldo will be there week 3 to help kind of bring this full circle. And then week 4, the 3 of us will be there to kind of give you another experience with the 3 of us together and how integrative these resources are. So hopefully that answers your question. If you're worried about it taking way too much of your time, that's not what it's designed to be at all. But it is designed to just be just this beautiful way of nourishing you in simple ways throughout the week and throughout this next month.
So I am gonna bring us to a close now because we're about 20 minutes over. We're pushing an hour and a half, but if there are more questions about the program or even about today's class, can you guys put in the chat, one of you, where people can send their questions? Kristen, you are so welcome. Thank you so much for being here. And I love this quote. This was actually Shelley and Rashmi's suggestion, and this was really beautiful. If you want to go fast, go alone. If you want to go far, go together. And, you know, we know this in Western medicine, we say this as well, that success rates are always seen to do better in people who are in groups or courses or in community. But obviously this is a notion or a concept that's been around for thousands of years by people much smarter than us. And I'm so grateful we were able to serve you today. I hope that this was helpful. I hope that you guys got value out of this morning's class and you're able to take something away from it. And we look forward to serving you all in the future. Thank you so much for being here this morning.
Thank you.
Thank you guys so much. It's been a pleasure. And you are so welcome, Brianne. Thank you for coming. Thank you for being here. We'll see you later.
I'm going to stop the recording. So.